A major issue when people think about hip and knee replacement is how painful is it going to be, particularly after surgery? Well, and if you ask enough people, you might hear some horror stories. And I want to shed a little light on where we are now in orthopedics and really where we've come from. So years ago, we didn't have the techniques we have now, but today we have techniques that we call them preemptive techniques. We try to treat your pain before you have pain. So believe it or not, when you show up for your hip or knee replacement, we give you medicine to help with your pain before you even experience pain. And our ability to get in front of it and stay ahead of the pain is critically important to your ability to participate in therapy and ultimately how well you do. Not to mention, you're not miserable, which is really important. We try to minimize our use of narcotics. We've learned, certainly with the opioid crisis, that narcotics are not our friend. And there can be huge challenges to people adapting or getting addicted to them even. We try to minimize our use of opioids and maximize our use of non-opioid medicines like Tylenol and anti-inflammatories, even numbing medicine, periarticular injections and nerve blocks to treat your pain. So you don't need narcotics, so you can get back to your life sooner and with less pain. It used to be that you're in the hospital days upon days. And one major reason you're in the hospital multiple days after hip and knee replacement was because of pain. Because of our pain techniques today, greater than 80% of people go home after only one night in the hospital, and many people go home the same day. It's important for you to get back to your quality of life. And so I hope if you're struggling, if you have that loss of quality of life, you'll reach out and look and see what your options are.